How you doing? This is Dr. Chris Cueto, aka TheStickDoc, your resident chiropractic warrior. So, what I'm going to start showing you guys now is how to first and foremost activate your core, which we're going to get into, as well as do some basic core exercises that you could do at home with maybe a few equipments that you have, whether it's a resistance bands or a physiotherapy ball. All right. So, first of all, what is your core? Well, core is not just your abs, it's not just your lower back, it's actually a whole group of layering of muscles that helps protect your spine. And it's all in the midsection here. So that incorporates not just your abs like your rectus abdominis, but we're also talking about other muscles like your transverse abdominis, your lower back muscles like your lumbar erector spinae, and deep within like your multifidi, which we'll get into a little in a second, as well as your gluteal group, your gluteus muscles like your gluteus medius, minimus, and maximus. So, without further ado, what I'm going to start showing you right now is, first off, getting into spinal neutral. Second, activating the 3 steps to activating your core. And then third, I'm going to start showing you a few of the exercises that I talked about, or I could start demonstrating with regards to some of your core work. All right? There's a progression. There could be a few things we're using equipment and so forth. So let's get into this now. First of all, let's get into what we call spinal neutral. So, trying to simplify it as best as I can, get your hands on your hips. You're going to go ahead and think about rotating your pelvis forward. Now, when I say rotate your pelvis forward, kind of imagine how your pelvis is a pitcher of water and you're just pouring it out in the front like this. And as you're seeing this, I'm just exaggerating it. You're kind of you're actually creating an extension or that curve of your lower back, kind of getting your butt up a little bit more too. That's your what we call an anterior or forward pelvic tilt, okay? If you're exhibiting pain in a certain angle or spot, I would say back off a little bit, okay? You want to be in an area where you're nice and comfortable. Next is we're going to go into what we call a posterior pelvic tilt or backwards forward pelvic tilt by bringing the pelvis back. And as I can show you here, you're actually dipping your butt down, and we're actually flattening your spine also too. Once again, if you're starting to feel some sort of discomfort or pain, you're going to back off a little bit, okay? So we're going to go forward and we go back. And sometimes I have patients, what they do, I have them on their back and they actually do the same thing. You can also put your hand against the wall, or if you're lying on your back. So this will be your gauge. If you're going, when I say anterior pelvic tilt, go forward, it gets off your hands. Okay, I can see here. And if I say posterior pelvic tilt, it should go towards your hands. So anterior or forward, and posterior, back. Get used to this motion. I'm going to spend a little bit of time also with this at another video. But okay, so let's say we're going to go into pelvic neutral or spinal neutral. All right. So from forward to back. All right. Again, this is a nice little bit of control exercise here. All right. Get yourself in an area where it's nice and neutral, what you're comfortable to work with, and that is your spinal neutral. So forward to back, boom, got it. Okay. From here, think about your abdominal muscles as 2 doors. I want you to close it in together. Now, the way I cue people about this is that when you're doing this, you don't want it too tight that you can't have a conversation. Yes, you're going to kind of suck in your tummy a little bit, but you're going to start activating these muscles. And as I'm doing this now, I can still talk, maintain a conversation. As I'm doing this is a little bit of a harder one. Your lower back muscles, I want you to fire them up. So put your fingers right to the lateral sides of your lower back muscles. And I want you to do is, as you're maintaining that brace in the front, you're going to go ahead and push your muscles as best you can out laterally this way against your fingers. It's a very subtle amount of motion. This one does take some time in practice, but I want you to really feel your hands on the lateral side of those muscles of your lower back and pressing out, okay? And then once again, if you're feeling discomfort out of it, I want you to back off a little bit. So once again, the caveat is doing this where you're comfortable maintaining it, activating it while you could have a conversation. Last, as I'm doing this natural brace now, think about your glutes. I want you to tighten up like you're pinching a penny in between. As silly as that sounds, that's the activation we want. And again, same thing. If it's do it pain-free and do it where you can still carry a conversation. So, as we do those abdominal bracing from pelvic neutral, we're going to get into a couple exercises here too. So first off and foremost, I'm going to show you pre-recorded one where it's called a Domino Bridge, what I'm going to get to right now. So as I'm doing this, finding pelvic neutral, boom, tighten your core. So forward muscles in the front, activation, glutes, activate, knees about shoulder width apart. Okay, we'll get to that in a second. Now your lower back muscles tighten up, you're pushing against your hands. Perfect. We're now going to get into the bridge. Now, first things first, if you could help it, cross your arms. If it's tough for you, you can put your hands on the side of the table for now. But as you're maintaining pelvic neutral, really working your core, you're gonna really use your glutes to push down towards your heels of your feet into the bridge. And you're maintaining core work, activation, then down, up, then down. You can put your hands across your chest, so now you have more focus on your core. Okay, and this is what we call a bridge. In a lot of gym circles, you might call it a hip thrust. You might see some folks even putting more resistance, such as a barbell weight. We don't have to get into that for now, all right? This is just really for you to really understand your body better, how to activate your muscles, how to do it properly, cautiously as well, and to start doing certain exercises too, okay? When we're talking about core, people think about doing full back work or crunches. I mean, yes, they do work, they're helpful, but again, that's more of a higher level too, okay? If you're hurting your back or just coming from a back injury, you wanna do it safely, this is a good start. And this is what I typically do for a lot of folks, especially in the very beginning. Again, any questions, don't hesitate to go to my website, contact me, www.heraldsquarechiropractic.com. I'm a chiropractor, we have physical therapists here as well. You can also consult with your healthcare provider or any other chiropractors or physical therapists in your neighborhood too, if it's hard for you to get to the city. Any questions? I'm here as your resource. Thanks again.